Hi there, I'm here with Alondra, and today we are going to talk about injections of Botox in your masseter muscle, which is this big muscle here that you grind with, clench with, chew with. That's where it comes from. It's a muscle of mastication, which means chewing, called the masseter, big muscle. And there's lots of reasons why people might want to have that muscle injected. One is if they have TMJ, which is pain from this temporal mandibular joint that's caused from grinding or clenching that is usually subconscious. Most people wouldn't ruin their teeth or have pain consciously, but it can be stress, it can be from family, it can be just from genetics, and there's lots of reasons why people might have that, but it can actually hurt your teeth and cause you to have different types of headaches, contribute to migraines and things like that. So that's one reason. And then the other main reason why people would have their masseters injected is actually for facial slimming. Which there's a caveat, that's why you maybe wouldn't want to have your masseters injected as well. So if people have a really square jaw because their masseter muscle is real bulky and it makes their jaw more square and they want a more streamlined kind of heart-shaped jaw, if you inject Botox in there, it's not instantaneous for that because it actually requires the muscle to slim down a little bit, which means that you can't be exercising it all day long. So the effects of slimming your jaw are going to take more like a couple treatments, and it might take more like 4 to 6 months before you start to notice some facial slimming. So the downside of facial slimming is that it can worsen jowling, because if you've got this big muscle that's holding up loose skin and now it slims, then you don't have as much to tent your skin up. So it can actually worsen the appearance of marionette lines or jowling. So some caution with that if that's a reason why you're injecting it. But for jaw pain and clenching and things, we usually start with 15 units on each side. It can take up to 50, but I've never used more than, I've got one gal that I think I do 25 units on each side. But I usually start with 15 on each side and have them wait maybe 4 weeks or so. It takes a little bit longer for this to kick into full effect. And the idea is not that they're gonna have slim, or that you don't wanna not be able to chew. You shouldn't be able to chew and open your mouth, but that the pain's gone. So I'm really treating this to where the pain's gone and then retreating every 3 to 4 months for TMJ pain to where hopefully the muscle doesn't continue to build up. Ways that you can help this is by not chewing gum all day long or doing something where you're undoing the effect that I'm trying to do. So if you're chewing gum, stop that. But otherwise, this is a quick, easy treatment. And that's what we're gonna do. So I'm gonna have her bite down. And I can feel it's like a golf ball right here. She's like a little chipmunk that has, and some people you can actually see it bulge out. Bite down again, Alondra. But for her, it's more of a feel thing. So it's a pretty easy injection. Bite down again for me, because I can feel right where it is. So you can do it as a single injection, but I like to do it as 3 injections just to make sure that I've got it spread out more and I'm hitting the whole muscle. So it's 3 little injections. I've got 15 units of tox in my syringe. I'm gonna clean it off just a little bit, some alcohol. And this one you want to make sure you get in there pretty deep. And I'm just gonna wipe her off. Have her not rub it. We don't want to rub in any other muscles. And then we'll do the same thing on the other side. Bite down for me again, Alondra. Yeah, I mean, it's like, I wish you could see this shadow. It's right here. It's like, boom, and it's almost like a drum. You can see how, actually, when I tap, here you see it bounce more, and here it doesn't because the muscle's so tight that the skin doesn't have as much flexibility. I can tell you, stop doing that, Alondra, but it's completely involuntary. She can't control it. This should kick in a few days, anywhere from 3 to 14 days, and pain should get improved pretty quickly. So that's it.